name's Megan. I'm part of the Monday Mornings with McLean team, and we're here with Dr. McLean. We're just going to ask him a few questions. So what are the primary differences between X-ray film and digital film?
Clearly the big difference is going to be in how the images are recorded. With film, we're going to be using X-ray film, traditional film processing with chemistry. With digital radiology, we get away from the film, we go to systems that can capture the image directly, and it goes to a computer directly for very, very quick and early analysis. Perhaps the biggest difference, however, beyond the mechanics of the equipment is the enormous amount of anatomical data and soft tissue data that's available on that image that you'll never see on an X-ray. Clear and obvious examples will be, for instance, when you do a lateral view of the cervical spine, it's very, very difficult to see some of the anterior soft tissue structures. You can't even see spinous processes that well on regular X-ray. And with digital, because it has a thing called a wide dynamic range. With regular radiography, you probably see maybe about 1,000 shades of gray. With digital, you can see up to 10,000 shades of gray. And so while you can't necessarily see all of those at the same time, what you can do is you can hit the grayscale thing on the monitor, move your mouse around, and you can bring out that tissue very, very quickly and very easily. And so from my perspective, it gives us just anatomy that's very, very valuable. And one of the other things too, it kind of reminds us is that even for chiropractors who are often interested in bones, being able to see not only bone tissue very well, but soft tissue characterizations as well becomes very helpful in really understanding musculoskeletal events. So that's really important to us. The other thing that's really nice about digital is ability to transmit images. For instance, I have clients scattered across the state of Iowa and Illinois that are able to send me images, and I can see those images when the patient is in their office. And on many occasions, I've actually had the chiropractor who refers me the images talk to me on the phone while the patient's in the office, and they have particular issues about the patient's complaints, such as trauma. And so I can look at those images just as quickly as I can look at the images downstairs in our radiology department. And in terms of patient management, that becomes really effective because now I can say to the doctor, hey, yeah, I see something on those images, but let's go ahead and do another view. And that can be all done live. So it's almost as if I am in their practices, again, gathered anywhere in the state, and I can take care of their patient's issues. So that's becoming really a dynamic way to take care of patients, and also, of course, to image these patients very effectively. The other thing about digital, too, that I think is really nice is that, on balance, there are, again, we'll talk more about image quality in just a little bit, but on balance, most chiropractors that go to digital imaging, their image quality will tend to improve over using film. So those I think, are some of the highlights in the differences between those two technologies.
Okay. Yeah. Are there any downfalls to having digital film?
Yeah, I suppose one of the big downfalls, I think, initially is making sure that you purchase the right equipment. And one of the real burning issues that I'm faced with is I get phone calls practically every day from chiropractors saying, you know, how do I buy digital? What should I look for? And what we are finding is that there are really three major types of equipment that you can buy in digital. There's very, very high-end hospital types of equipment where you could pay anywhere from $80,000 to $150,000. Clearly, that's going to be way outside the pocketbook of private practice. On the other end, you will have digital equipment, and some of our colleagues get very excited about this, that you can purchase for $15,000. Well, unfortunately, you're not going to get very good quality for $15,000.
Right.
And so one of the things that I'm spending enormous amounts of time with is consulting with chiropractors, and again, that's part of my job and part of my business in consultation, is to talk to them about what are some of those major things to look for in digital equipment. And so right now, I have heavy concerns about digital imaging equipment, and I would encourage any chiropractor out there that's thinking about going into digital, please get some help, because you cannot rely on the specifications of the equipment that often the vendors will send to you. For instance, I can show you some of the baseline specifications between a $15,000 one and a $150,000 piece of equipment, and the baseline specifics will look very, very similar. So clearly there's more going on with that, and really the big thing that we'll find is that measuring the differences objectively is difficult, because what we'll find is that the real magic in digital is not so much in the imaging plate, although there's good technology there, but it's actually in the software. So what happens is that in X-ray of film, you simply put photons to a patient, it goes to film, and there's your image. In digital, we have this very magical interface of software actually interpreting all that grayscale data to present it to us in a way that we can understand it. And there are vast differences in how this software actually does its job between different companies that you can't measure very well. And it's a trade secret of these companies. And they, the only way to evaluate this, I think, is to bring these systems into your office and see how they actually operate in a clinical environment. And that's exactly what I do. At the beginning of this year, for instance, I evaluated probably a dozen different digital companies to find the imaging system that would best suit our clinical environment here. And it's a very extensive process, but I can take that learning environment back to my colleagues out there, and indeed I'm doing this now. I actually have this listed out so they have a sense of these different pieces of equipment. But those are some real major issues that we're faced with.
Well, that was very helpful. Thank you for your time,
You're
Dr.
more
McLean.
than welcome, thanks.